The health department says that the Philippines is on its last mile of the COVID-19 vaccination program. To tell us more about this, we have NTF Special Advisor Dr. Ted Herbosa joining us via Zoom. Good afternoon, Dr. Ted. Thank you for joining us.
Hi, good afternoon. Good afternoon to all the televiewers.
Now, Dr. Ted, how is the country's vaccination going so far? Are we on track to reach the 90 million target by end June?
So far we have 65 million Filipinos already with 2 doses. We have about 11.4 million with the booster dose, and we have about 69 million with the first dose awaiting their second dose. So we just concluded our national vaccination days wherein we targeted 1.8 million more doses. However, we did not make the target. We only reached about 70% of that at 1.4 million doses delivered. So we're continuing to push for more vaccinations, especially now that we are in lower alert levels. And in fact, there are areas that cannot reach alert level 1 because of their low vaccination rates.
Do you have any, can we name at least, can we specify at least these areas, Dr. Ted?
Yeah, we have a little over 30% in both BARM and the Mimaropa regions. So the Mimaropa is our island region, so there's really difficult access for the vaccines. And our BARM also, we have a lack of vaccinators and the areas are quite remote. So we're ramping up the vaccinations in those areas. It seems this is the reason for our saturation, because most of our urban centers have reached 100% or 70 to 100% of their target vaccinations. So it's really in the more remote areas where we need to ramp up vaccinations.
Okay, does this mean also, Dr. Ted, that you are going to extend efforts to hold mass vaccinations? I mean, like what you mentioned earlier, you have been missing your targets. And do you also somehow factor in the possibility that whenever cases are down, that's when inoculation somehow slows down as well, leading to the government at least missing its inoculation targets?
That's correct. No, our opinion is that many people, when they are not scared of getting infected, tend to forgo with their either scheduled second dose or senior citizens that need to be vaccinated. So there is no fear, of infection. But in fact, the opposite is true. That we should actually be getting vaccinated because, as we all know, this cycle of outbreaks is it will get low and then it will get high again, as what's happening in the nearby countries. So we're really pushing and recommending that our countrymen continue to get updated with their vaccines. Those that need a booster, 3 months or more from their second dose should already get vaccinated. And our senior citizens, who we need to protect, must get their vaccinations already.
Now, of course, Dr. Ted, we're already in the thick of the election season. Will this in any way affect the vaccination timeline as well?
Yeah, yes, because I think our last national vaccination day is this March, because again, April will be with the campaign season and Holy Week. So all the local governments will start campaigning. So we may have difficulty with dependence on local government units in terms of vaccine administration. And then the May will be election time already. So again, that's going to interfere with our vaccination drive. However, we have shifted our efforts to private sector. We passed on some of the vaccination of the booster to our boticas or drugstores. And now the Philippine Medical Association with its doctors' clinics have also volunteered to help the government ramp up injections of booster doses to all those that need them.
Okay, should the government reach its target of inoculating a huge percent of the population by mid-year, what's next on the agenda here? Are we looking at a possible transition to a new normal by then?
Correct. Our target is by June 30, we have inoculated 90 million Filipinos with 2 doses, minimum of 2 doses. So we have 90 million Filipinos fully vaccinated by the end of June. And with that, I think more restrictions can be lifted. Even wearing of masks in outdoor may possibly be removed because the risk will be lower. Also, this helps us in terms of our tourism efforts. We are inviting more tourists to visit the Philippines because by then, at 90 million, most of our tourism workers would be vaccinated already.
Now, lastly, Doc Ted, before we let you go on another topic, are you seeing less demand for COVID testing as well? And where is the demand coming from, if ever?
Well, as you know, we have shifted our testing. We now include the antigen test as well for those traveling to the Philippines. You can choose either a PCR test 48 hours before your flight or an antigen test, a laboratory-based antigen test 24 hours before your flight. So it's now an option to get the antigen rather than the PCR test. Also, we continue to test. We call it the expanded targeted testing, wherein if you are exposed, you have symptoms, we will have to test you. And if you are going to be hospitalized, we are going to test you. So we continue to have about 20 to 30,000 tests per day.
All right. Thank you very much for your time this afternoon. Again, NTF Special Advisor, Dr. Ted Herbosa.